Hello and welcome to the Taking Your Baby Home talk. Hello, my name is Eliza and I'm the home visiting nurse for neonatology services at the Child and Adolescent Health Service. Today's talk will be helping you take your baby home from the neonatal unit. We will discuss the behaviours and needs of the preterm baby and the supports available to you in the community. The role of the home visiting nurse is to visit those babies born less than 35 weeks and or less than 1800 grams in the Perth metropolitan area. If you fall outside of our catchment area, then we will provide support to you via phone or telehealth. You normally receive 1 to 2 visits depending on your needs, and then I will hand over to your local child health nurse. Due to COVID-19, some in-person visits are getting delayed, however we will get to you as soon as we can. Otherwise, we will follow up via phone or telehealth. Now we will discuss feeding your preterm baby at home. We know that preterm babies have low stamina and get tired easily, so the idea is to continue the same routine from hospital when you go home. If you've been doing 2 to 3 breastfeeds in the nursery environment, when you first go home, you continue to do 2 to 3 breastfeeds and the rest bottles. We do this until baby is weighed and checked to make sure they are gaining weight, conserving energy, and feeding well. Knowing that you'll be needing to use bottle feeds when you go home, it's great to know which bottle works best for your baby. You might need to try a few different teats. Gradually, as we weigh baby over the next few weeks after going home, we will slowly start to increase the volume of milk and the number of breastfeeds as baby gains weight. It is important to buy or rent a breast pump and continue expressing after your baby goes home. This will help maintain your milk supply as your baby works up to getting to full breastfeeds. There are a variety of different brands on the market. It is common for preterm babies to be stagnant in their weight gain or sometimes even lose some weight when they first go home. Remember, this is a huge transition for them leaving the nursery environment and going home. Don't worry, we will work through this together. It will take time for your baby to adjust to the home environment. The nursery can be quite noisy and bright at times, so going home to a quiet and dark house will be different to them. For this reason, we try to mimic the nursery environment. Things like playing some music or a white noise machine when they go to sleep, or having a dim lamp on in the room overnight so they're not sleeping in complete darkness at first. Preterm babies can be quite grunty and restless sleepers. This will take time getting used to sleeping next to. It will also take time learning your baby's cues over the whole 24-hour period. At times, they may be upset, other times hungry, and other times perhaps alert and wanting to look at you. Getting used to this new routine will just take time. It's a huge adjustment for the whole family, parents, baby, siblings, pets, grandparents. It may feel abnormal at first, but soon you'll find your own routine. Thermoregulation or temperature at home. It is a good idea to start taking baby's temperature in the nursery and having a feel for their core temp. So feeling their chest, their neck, their tummies, to feel what's normal for your baby. So when you go home, you don't need to take their temperature with every cares. As a general rule of thumb, we normally dress babies in 1 extra layer than what we're wearing. Layers are better than big heavy blankets, so then we can just simply remove a layer if they're too hot. If baby is too cold, the best way to warm them up is skin to skin on your chest with a blanket over the top. Once they're warm, we add layers, so starting with a singlet, a onesie, a grow suit and maybe some booties. Beanies are a known SIDS and suffocation risk and usually aren't needed in Perth due to our climate. It is okay to use them if it's a cooler day and you're watching baby. Air cons and heaters are fine as long as they're not directly blowing on baby. It is important to feel comfortable with maintaining baby's temperature and how to dress baby, because we know that a cold baby can lose calories and then lose weight. Safe sleeping is an important aspect of going home, so I will go through the SIDS guidelines with you once more. Here are the 6 important steps. Point 1. Always place baby on their back to sleep. This keeps their airway clear and ensures protective reflexes can work. It reduces the risk of suffocation, overheating, and choking. Point 2. Keep your baby's face and head uncovered. Babies control their temperature through their face and head, so keeping your baby's face and head uncovered during sleep helps reduce the risk of overheating. It also helps keep the airways clear, which reduces the risk of suffocation. Point 3. Keep your baby in a smoke-free environment. Smoking during pregnancy and around a baby once they are born increases the risk of sudden infant death. This includes secondhand smoke. If you or your partner smoke, don't smoke around the baby and never smoke where your baby sleeps. Point 4. Safe sleeping environment, day and night. The safest place for your baby to sleep is in their own safe place with a safe mattress and safe bedding. Babies should always be placed on their back to sleep with their feet at the bottom of the cot or bassinet. A safe cot meets Australian standards. A safe mattress is firm, flat, in the right size for your cot. Safe bedding is lightweight and firmly tucked in and only pulled up to chest height, or using a safe sleeping bag which is fitted well across the neck and chest with baby's arms out and no hood. Point 5. Sleep baby in a safe cot in the parent's or caregiver's room for the first 6 to 12 months. The safest place for a baby to sleep is in their own safe place in your room or a caregiver's room. And point 6, breastfeed baby. Breastfeeding has been shown to reduce the risk of sudden infant death. Preparing to take baby home also means getting the capsule ready to take baby in the car. Always follow your manufacturer's guidelines to ensure safety. For more help, see KidSafe WA. Their website is attached just here. Once you've got the car seat securely in the car, it is also important to know how to position baby. Make sure that their straps are secure so baby doesn't move as the car moves, and also so their neck is safe. To protect their airway, the neck can't move from side to side or up and down. The car seat must also be in the back seat. Preterm babies are at increased risk of picking up illnesses and infections, so it's important to know where to seek help and when to seek help. To avoid infection, it is important to continue hand hygiene on discharge, using either an alcohol-based hand rub or soap and water, as well as zero exposure to cigarette smoke. Signs that your baby is unwell include changes in their breathing, lethargy, or if baby is unusually tired, poor feeding, dry nappies, and temperature instability, so if baby is too hot or too cold. If you're worried about baby, you must seek help. The best place to go is the emergency centre at your local hospital. If it is non-urgent, you could see your doctor or phone me or your local child health nurse. Common illnesses and infections that babies can pick up include respiratory infections. When babies first go home, they often do sound a bit snuffly and blocked up. This is normal and will resolve. However, if it's affecting their breathing or their feeding, do seek help. Other infections include gastrointestinal infections, such as excess vomiting or loose stool. Skin infections include things like rashes or thrush, as well as sticky eyes are common. The best way to clean this is with some normal saline from your local chemist and with a clean cloth, as well as a gentle tear duct massage with some clean hands. Please seek help if the eye is overly red or pussy. Immunisations for preterm babies are given on their actual age, so 2 months, 4 months, 6 months from their actual birthday, the day that they entered the world. You can get your immunisations done at either your GP or an immunisation centre. For more information, look in your baby's purple book and the schedule will be seen on the back page. If your baby might be going home on some discharge medication, it's a good idea to start practicing them while your baby's still in hospital, so speak to your bedside nurse about that. There are many available support services in the community, including your local child health nurse, lactation services, and your local doctor. Babies born less than 32 weeks gestation and/or less than 1,500 grams and/or have a serious illness are enrolled in our neonatal follow-up program. Those babies are seen at term, 4 months, 8 months, and 12 months. If you live in the country, you will be either seen by a telehealth or by a rural paediatrician. We also run a physiotherapy playgroup at King Edward, and those babies are brought back to the hospital at 3 months corrected age. There's also a lot of other community supports available. Those listed at the back of your purple book are for everybody. Those include Nagala, KidSafe WA, Multiple Births Association, and also Health Direct, a very handy nurse on call. Reach out to support if you need help. If your baby is born at King Edward, you have access to the breastfeeding centre, clinical psychologist support, and physiotherapy as a mother. Congratulations on graduating from the Neonatal Unit. Please enjoy your beautiful baby at home. All the best.